Hello and welcome to Ask a Sex Therapist, a space where we explore sexuality, intimacy, relationships, and sexual well-being with curiosity, compassion, and evidence-based understanding. I'm Justine Gilliland, a sex therapist and counselor, and in today's episode, we're exploring the question, why can I stop watching porn? Feeling overwhelmed or distressed by your pornography use can be incredibly isolating. Many people are impacted by out of control pornography use and often search for answers online. Acknowledging these feelings is a courageous first step, and you are not alone. The sense that you are unable to stop watching porn may be a sign of porn related distress. Today, I'm going to explore what porn related distress actually is, signs it may be affecting your life, why it can feel so difficult to reach out, and how sex therapy can support recovery and healing. Understanding pornography related distress. What the heck is that? Often, porn addiction is a term people use when describing their struggles. In therapy, we often refer to this more broadly as porn-related distress, problematic pornography use, compulsive sexual behavior, or out-of-control sexual behavior. There is no single consensus on terminology. One reason some professionals are cautious with the word addiction is that it can feel like a fixed and heavily negative label, which can increase shame and judgment. There is also currently no official diagnosis of pornography addiction. The closest diagnosis we have at present is compulsive sexual behavior disorder within the ICD-11. The research in this area is still developing. However, there are experts in the field that acknowledge research suggesting that pornography can become addictive for some individuals in the way it impacts the brain, behavior, and life functioning. At the same time, this is not true for everyone who experiences their relationship with pornography as distressing. Regardless of terminology, what matters most is the impact on your life. You do not necessarily have to be addicted for pornography use to become distressing or harmful. Porn related distress describes when pornography use feels out of control, creates significant distress, and negatively impacts daily functioning or relationships. So, what are the signs that your pornography use is distressing? One of the clearest signs is when pornography begins interfering with daily life or relationships. This may affect your partner, family, friendships, work, study, or your sense of connection with others. There may also be a growing sense of compulsivity, feeling like pornography is the only thing that brings relief or pleasure, needing more frequent or more extreme content, or struggling to stop despite wanting to. For many people, pornography also becomes connected to emotional avoidance. Pornography may be used to escape loneliness, boredom, anger, stress, shame, or emotional pain. And yet afterwards, there may be the experience of guilt, anxiety, depression, or an even deeper sense of isolation. Some people also notice impacts on focus, sleep, sexual function, erections, or their experience of intimacy and desire with a partner. Secrecy and isolation also tend to grow over time, and unfortunately, shame often fuels that secrecy. Why can it feel so hard to reach out? Pornography is often surrounded by secrecy and stigma. Many individuals experience deep shame around their struggles. Shame is the belief that something is wrong, dirty, or broken at the core of who I am. And shame not only adds to the pain, but often fuels the very cycle people are trying to escape. I really want to emphasize You are not broken, dirty, or alone. Many people struggle with pornography-related distress. Reaching out for support is often the first step in breaking the cycle of shame and moving toward healing. What support options exist for porn-related distress? There are many possible paths to support, and each individual needs to decide what best fits their needs and values. Therapy provides the space to explore the function pornography serves in your life, emotional regulation, shame, self-worth, coping strategies, and the deeper factors driving behavior. Couples counseling or relationship therapy supports rebuilding trust, healing relationship wounds, improving intimacy, and strengthening the relationship together. There are also group-based programs such as 12-step fellowships, Sex Addicts Anonymous, or Sex and Love Addicts Anonymous. However, a word of caution with these groups is often they are heavily focused on abstinence and can be shame-based in the way that they navigate these issues. And so, for some people, they may have a very positive experience with these groups, and for others, they find that these groups can be more problematic than helpful. There are smart recovery programs where it is a group situation and it tends to be more evidence-based and skills-focused in its approach to behavioral problems. Small steps you can take right now. You do not have to wait until therapy begins to make changes. Some small starting points include reflecting on who you are outside the behavior. What are your values, strengths, goals? What is the kind of life you want to live? Understanding your patterns. For example, taking note of what happens right before pornography use, what emotions or situations triggered it, and what is happening afterwards. Taking small, achievable steps include reducing rather than immediately quitting, introducing barriers that make porn use more difficult, changing up environments, or even using app blockers. Another step is to explore emotional regulation, because avoidance of emotion often drives the cycle. And importantly, building support. Shame's instinct is to hide, isolate, withdraw, and lie. Healing often requires safe connection. Who are the people in your life that you can start having a conversation with about your pornography use? How can sex therapy help with porn use? Sex therapy provides a safe, confidential, and non-judgmental space to talk openly about your relationship with pornography. Therapy explores underlying emotional factors, trauma, low self-esteem, shame, compulsive patterns, and your broader relationship with sexuality. Together, we identify your current strengths, coping tools, and the areas where support and growth are needed. The goal is not simply stopping a behavior, but moving toward greater self-acceptance, emotional regulation, meaningful connection, and a healthier relationship with sexuality that aligns with your values. I offer online sex therapy across Australia, supporting individuals and couples experiencing pornography-related distress and compulsive sexual behavior. My final thoughts on pornography-related distress is that it is so much more than simply watching too much porn. For many people, it reflects emotional pain, coping patterns, shame, loneliness, or unmet relational and psychological needs. If pornography use is causing distress, secrecy, or disconnection, support is available. You are not alone in this experience, and you do not need to navigate it alone. Thank you for listening to Ask a Sex Therapist. This podcast is a space where I'll be exploring common questions and themes that arise in my work around sexuality, intimacy, relationships, and sexual well-being. Topics that many people quietly struggle with, but rarely talk about openly. If you'd like to learn more, explore related blogs, or inquire about online sex therapy across Australia, you can visit my website at wellbeingcounsellor.com.au. You can also subscribe for future conversations about sexuality, intimacy, relationships, and emotional well-being.